Okay, so we are live on Facebook now. Hello and welcome to today's Healthwatch Live. Today we're live with Trinity Food Bank, Radcliffe. And I'm just going to share my screen so you can see my slides. Okay, hopefully you can see those slides now. I'm just going to start by going through our guidelines for commenting and interacting with us today. So if you do want to comment on this live stream with some questions for Tina, please ensure that you are accepting and you respect people's boundaries. Don't make rude comments. Don't flood the chat. We will get to your question. Anne-Marie is joining me today and she's one of my colleagues and she is going to be moderating the chat to make sure that everyone is following these guidelines. Just to say, don't self-promote or try and sell anything. More to keep on topic today. So here's a quick overview. So to start with, I'm just going to go through about Healthwatch Bury, who we are, what we do. And then Tina is going to tell you a bit more about Trinity Food Bank and all the things that they're doing at the moment to support people in Radcliffe. And at the end, we have a Q&A with Tina. So if you have any questions about Trinity Food Bank and what they can offer, please comment them below. So Healthwatch Bury, we are a health and social care champion. We collect views from people who use NHS services such as GPs, dental care, and also health and social care services as well. We listen to your experiences of using these services to help make them better in the future. And I know that if you do Google food banks in Bury, then Healthwatch Bury does come up. But we are not a food bank ourselves. We just provide information and signposting to food banks. And if you want to contact us, our phone number is 0161 253 6300. And if you want to email us, it is info@healthwatchbury.co.uk. And I put those contact details in the description of this video. And you can also visit our website, which is healthwatchbury.co.uk, if you want to find out more about food banks in Bury or any other services that are on offer in Bury. We also have a Twitter and Facebook and YouTube. And this video will be uploaded to YouTube with captions after the live stream today. So you can share it with people who may not be using Facebook, just so they can find out more about Trinity Food Bank. So I'm going to hand you over to Tina now, who is going to be sharing more about what they do at Trinity Food Bank.
Okay, thank you very much. Thank you, Catherine. I'm going to show a few slides from a PowerPoint presentation that we recently did for the British Sociology Association at a conference. And it's just to highlight some of the things that food banks have been doing, not just our own, but food banks throughout the country and throughout Bury, and a little bit about the Bury Community Support Network. So I'm just going to share the presentation. I'll just find it. Sorry, find where I was up to. So sorry. I did have it before. There we go. Microsoft OneDrive. as you can tell, I'm not very good with IT. Oh, I can't find it. Hmm. No, I'm sorry, I can't find it. I thought I had it on this device, and I haven't. So I'll just have to chat along. Trinity Food Bank, as well, it was originally Rock Food Bank in Radcliffe and was opened in 2017 by Sister Joan from Caritas Charity. It was a very small food bank looking out of the Rock Centre and Westminster Avenue, and possibly doing about 20 food parcels a week at that time. When COVID hit last year, all the volunteers had to isolate because they were older and had some medical issues, etc. So ourselves from Corrie Gardeners Community Group and Trinity Baptist Church volunteered to help to source food and deliver food throughout that period, obviously not expecting it to be a large amount of food and for such a long period of time. We worked with Anne Noy at that particular time, who was a community hub manager in Radcliffe, and she helped us to identify people that needed assistance at that very early stage. And quickly, within 4 weeks of starting, we went from the 20-25 food parcels a week to 140 food parcels a week. So obviously we had to try and find drivers to deliver those parcels. We had to work differently to how it was before in a little box office. We had to try and find space to spread out to make it easier for volunteers to pack bags and to make it that we were distancing and things like that. So we quickly spread into the Rock Centre and used it like a bit like a supermarket. Had everything spread out, and we basically worked a one-way system to pack bags. And then they went into an area where they were picked up by drivers and then taken to the client's address and dropped at the front door. During this period of time, we identified that there were lots of people suffering lots of different poverties in Radcliffe. We knew it existed. And during that time, we were working with Bury Council as well, amongst the hubs that they had got, the community hubs, to identify people. And we worked with Bury VCFA and the other food banks in Bury. This was to prevent any overlap of delivery areas, so that we were all staying within our own area of Bury, or so we were split within the 6 townships, and we covered postcodes so that we didn't overlap and we were all delivering within our own spaces. So quickly the community hubs could refer those people quickly to the food bank that was relevant to their area. We relied very heavily on lots of people that have obviously were out of work at that time, and we hadn't ended up with drivers from Six Town. We ended up with drivers from the councillors. The councillors came in. We had people from other community groups volunteering to help, and we quickly developed a system that worked very efficiently. During that time, we then developed what we called Bury Food Aid Network with the BCFA and the council. And in that group, there are 15 food banks across the borough. Not just food banks, we had clothes banks, and we also had an halal food bank and a Jamaican and Caribbean food bank. So what we did, we started to all work together and met weekly at that particular time to identify food shortages or identify if there was any other issues cropping up within the people that we were helping. We then found out there was lots of digital poverty amongst people, especially at that time, working from home. and also the children having to work from home on laptops and tablets. And so we quickly identified that to the council and the schools locally, and some of that was resolved within the schools themselves by asking for old tablets, etc., that they could give out to families in need. And then we could actually get a SIM or whatever for them to be able to use some internet connection of some sort. As COVID progressed, we then found that people were moving into properties, being given keys, and didn't have any access to any furniture. So charity shops were shut where most people would normally go and buy the furniture. So we met a man, how it was identified, we met a man who was sleeping on a duvet. He'd been living on the streets, got a property, and his words to us was, I would rather be back out on the streets because at least I hear people passing and they speak to me. I just feel like I've just been brought in here and just left. So we quickly put a shout out on social media and got him most of what he needed within a weekend: a bed, settee, a refrigerator, etc. And as people were getting the properties redeveloped over the COVID period, we got offered very good quality second-hand furniture and white goods, and we got those tested. And people that were struggling, we got them out to them quickly. And we got offered a storage unit where we could keep stuff, and we still have that storage unit free of charge. We also identified that people were struggling with benefits and how to access help with debts. So we quickly identified that the food bank was not just about the food, it was about all the other issues that go with food poverty. It was the fuel poverty, the uniform poverty, the digital poverty. It was just anything really that people were struggling with the mental health as well. We found in that time. So at the very beginning of COVID, we decided that we would ring people once a fortnight to see how they were on our list. So we were ringing them up and just keeping in touch with them just to see if they were managing. Did they need anything else? Was there anything else we could help them with? And mainly, it was just that they just wanted that chat once a fortnight, just to speak to somebody. They'd probably not seen anybody for weeks and weeks because they'd been isolating and they were suffering with their mental health. We just didn't get people asking for food. We had people ringing up because they didn't know what to do. Our clientele at the very beginning were people very much who were probably isolating, and we didn't know what was going to be happening with food. There was the panic buying, etc., and there was people that were older who couldn't get to the shops, etc., couldn't get deliveries, couldn't do online shopping, so we were helping all those people. But we also identified that a lot of people just wanted that chat once a month or once a fortnight, and we continue that now just to keep in touch with them, just to have a chat with them. But now it's mainly about empowering people as we move forward. It's about signposting. It's about helping them to have a healthy lifestyle. Very much at the very beginning, it was processed food in tins and packets. We're now going to, we've got fresh food coming in weekly, and we try to offer advice to people about nutrition. And the one thing that we want to do is doing cooking on a budget with families and single people. So we know that's a difficult thing for families. We find out lots of families didn't know about Healthy Start vouchers. So we got a delivery of the leaflets and put those in parcels for families so that they knew that was available to them. During COVID, we put lots of information leaflets in food parcels of things that we thought were relevant to people to help them to get some extra help. We worked with council during the winter to get fuel vouchers out to people who were struggling with the fuel. And we still work with council, and we work with Energy Works, Groundworks to promote help with fuel poverty and people who are in debt with the fuel. We also work with people who are coming from different areas. So we get a lot of people from Salford and Manchester City Council into Radcliffe, and they're referred to us by their councils for food parcels. During COVID, we had a lot of people escaping domestic abuse, and we picked those people up by way of referrals, whether it be a friend or whether it be a statutory agency. And we were able to get clothes to them and food and get them other assistance. So it's not a food bank as such. It's very much about signposting. We now are back up and running with digital skills sessions on a Friday morning, 9 till 12, with the digital champions. Bury Council fitted us some internet in with Virgin Media. So we're able to access a community internet hub where people can come and learn to do their digital skills, and that's any age. It's not just, we want them to come along because we know that Ask Your GP and ordering your prescriptions online are very, very difficult. It's difficult for me, so obviously it's going to be difficult for other people. And they've got the use of tablets there that they can use, and they can do those sort of things at the cafe. We have a cafe as well, a drop-in cafe, which is 9 till 12. And that's just for anybody to come and just be sociable, any age group, any ability, any disability, anybody's allowed to come. We've got other things that we've got in the pipeline because we now all work together in different community groups, but all come together to deliver things for people locally. So we've been working with Creative Living Centre in Prestwich, and they've been delivering some sessions on a Thursday morning to help with people's mental health. Thursday afternoons, they do a craft session, which is very low key craft sessions, just for people to have a chat about how they're feeling and just to get together. And we've identified that we've got people who want to do things like walking netball. So we've been funded with a grant for that, to take that forward for people of all abilities. And we also have got a fund come forward for asylum seekers and refugee football. So we're trying to bring all those different communities together because we've realised that we've got so many different people living in Radcliffe now, whereas before we probably didn't have as many asylum seekers and refugees and ethnic people, and now we're getting lots of people from different areas, Iranian, Syria, Africa, and so we want to bring all those people together to be part of the community. So the food bank's just not a food bank, if that makes sense. So is there anything you want to ask me, Catherine, or anybody?
Thank you, Tina. It's a really great example of how our community has come together during COVID just to support each other. I think Anne-Marie has a few questions that we've collected. She's going to go through those with you.
Okay, thank you.
Oh, thanks for the presentation, Tina. It was really useful, and some of the things I wasn't actually aware of either.
Thank you.
It was really, really interesting. Yeah, we've had a few questions. One of them being, do I need a referral from another organisation to access the food bank? No,
our food bank, what we do is we do a referral system, but what it is, it's just a general chat and a sit down. All they need to bring with them is just a proof of address, and we'll go through the form with them as to the reasons why they need the food bank, and they can do a self-referral. There's no need to be referred by an agency. And then from that, we then do a 6-week review at 6 weeks, see what the situation is then, and see if there's any signposting or any other help we can offer with regards to either debts or budgeting skills and things like that. So that's how we work our system.
Oh, that's brilliant. Thank you. That's great. We've got another few questions. One of them being, how do I donate to the food bank? And is it better to donate food or money?
We get asked this all the time. We take either. We have donation points in Radcliffe. We have one at Outreach, which is the residential community support centre in Radcliffe on Blackburn Street. So they take donations for us. And Radcliffe Market have recently started a donation point as well in the market. We take donations of food Thursdays and Fridays, which are the days we're open 9 till 12. Or we have a website, and we also have a PayPal account that people can pay into if they wish to, or an Amazon wish list. So we've got quite a few different ways that people can donate. Thank you.
Oh, that's great. We can maybe promote your website on our website as well.
Thank you.
Another question that we've had is whether food banks cater for different dietary requirements, such as gluten-free, dairy-free, and nut allergies. I wasn't sure.
In actual fact, yeah, Anne-Marie, during COVID, we came across many intolerances and food, allergies, etc. And we have catered for many different things, like we've had gluten-free and all those sorts of things available. So if we have it, we will try our best to assist people with it, gluten-free bread and things like that. And we do try our very best when we get our vegetables delivered on it's late Thursday morning, to give people as much fresh stuff as we can do, especially if they've got children and things like that with fruit and stuff. We like to make sure that the families have got fresh vegetables. But as I said, we do have 2 food banks within our network. One caters for halal, and we also have one that's a Jamaican and Caribbean food bank that caters very much along the fresh side of food. And I've got the information for those.
Oh, that's brilliant. Thank you. That's really useful. I don't think we've had any other questions from the members of the public, and I can't see any on the chat either. I don't know if you've had any more, Catherine.
No, I think those were the only questions that we had. So probably like the support network, Catherine, would that help, the Bury Community Support Network? Yeah, if you can share a bit more about the other food banks in the network. Yeah. Bury Community Support Network, it came about with us working together. So I think there's about 14 at the moment. So we've got Brandlesome Community Centre, which is a food bank which covers that area. There's Ramsbottom Pantry, the Attic Project on Walmsley Road. There's Toppingfold Community Centre that covers that area of sort of Fairfield. And then there's Chesham Fold Community Centre. There's the Bury Asian Women's Centre, which does the halal food. And there's the African and Caribbean Women's Centre that I believe is in the business centre near Wicks, I think. But I've got all the details if anybody wanted them, that do advice as well as food for people. We've got our Organic Soul. There is the BAME project, which is based at Newton's on the Rock. There's Trust House in Whitefield, which is a food pantry, not a food bank. And there's ourselves in Radcliffe. So we all cover Bury area. I don't think I've missed anybody off. If I have, I'm very sorry. But we all tend to work together. If we get a referral that's not for our area, we'll take the details and we'll pass it on to the relevant food bank to pick up, and they will deal with that in their area solely. We found during COVID that people were getting several food banks from several different sources. So we were finding that that was a drain on a lot of the food banks. A lot of the food banks rely extremely on donations. None of them, are charities, and there's very little sort of funding about for food banks really. So we rely solely on donations to help people. We know that the situation's not going to go away, and we know it's going to get worse. We've had people recently, we've seen the change in people coming to us. It used to be mainly benefit based. It's now people that are working in care or are on 0-hour contracts. All the people that have never been out of work before, never had to use the benefit system, are out of work and are now solely on benefits and still struggling to pay a mortgage. People who are living in the private sector, their rents are astronomical. So if they're working in a care job on a low income, and getting some benefits to top up, most of that is probably going on the rent. So they've got very little money left. People that are arriving in the country with little or nothing. So it's all those sort of people that the Bury Community Support Network are assisting. We've got translators in the community as well, who are all volunteers. Nobody gets paid for doing what they're doing, and they've all done a sterling job over the last 12-18 months. Some of them doing 7 days a week, emergency food parcels and things like that. And we all work together now in the support network. We've met with Andy Burnham online at one of our Zoom meetings to discuss poverty and digital poverty, people not having access to bank accounts. All these things are things that people don't see. People that are using the Friends bank accounts to have the benefits put in because they can't get a bank account, and that so-called Friends charging them for that use of the bank account. All these things lead people into deep poverty, and people with substance use problems. We've seen a rise in those people that perhaps were coming off substances just before COVID and have gone back. The rise in suicide rates. We lost 6 young men in the last 8 months to suicide because they couldn't hack the lockdowns anymore and the loneliness. And we just feel that we needed to do that much more than food, and felt we were already doing that. So that's why we changed it from the Food Aid Network to Support Network, because it was very much an entry into all the stuff that was happening behind the scenes and what people were doing more than food. So yeah, and I think we also offer help. Creative Living Centre offer help to our volunteers if they feel that things are getting too much for them sometimes, to talk about things, especially when we lost the young gentleman, the 6 young gentlemen that were clients of ours recently, and it affected them very much so. And the second lockdown affected volunteers more so than the first lockdown, because I think they thought we're coming out of it a little bit slowly and we can start getting back to normal, and then all of a sudden, wham, it hit again. And I think it's been a tiring 18 months, 2 years for volunteers as well as people that have been working. And I think sometimes people forget those volunteers that have been behind the scenes doing stuff and working really, really hard to get stuff out to people. So so that's what the Community Support Network's about. We meet monthly, and we all assist one another, and we work with the council as a partnership to try and get council to understand what's happening at grassroots level. So I hope that helps to explain what we do.
And are you recruiting for new volunteers at the moment?
Lots of food banks are. We are very, very fortunate that we've retained a lot of our volunteers, and we get people volunteering all the time. And now that the drop-in cafe's opened up, we've got a few more volunteers on board. But I do know that some of the other food banks are struggling for volunteers. I know that Cheshuntfold are very much struggling for volunteers. If anybody lives in that area or can travel to that area to assist, if they wanted to contact Six Town Housing, they would be able to put them in touch with Cheshuntfold Community Centre to assist them with their food bank moving forward. And I'm sure that any of the other food banks would be grateful for any assistance. I mean, we will be looking for recruits in the future when we sort of start to move forward with our other projects. But we at the moment for the food bank, we do have a very, very good core of volunteers, and they've been absolutely fantastic. Thank you.
Thank you. If there's no more questions, I think I'll just wrap up the live now. Thank you, Tina, for joining us today and sharing about all the work that you do.
Thank you very much.
And we'll be updating our information on our website about food banks. And we'll also compile all the information that you talked about today on our website as well.
Okay, thank you very much. Okay, thank you for having
Thank
me
you.
anyway. Thank you very much.
Thank you.
Thank you. Bye. Bye.
Bye now.
Bye.